Welcome back. We're keeping an eye on your health today, and today we are talking about anemia. Dr. Bose, what is anemia to begin with?
So anemia, let me show you an analogy. I'm going to show you this choo-choo train right here, okay? So when we breathe, we take in oxygen, and that oxygen attaches to our red blood cells, and then our red blood cells, like a choo-choo train, carries that oxygen all the way to your tissues. So if you look at this train, each one of these are a red blood cell. And anemia is when you don't have enough oxygen carrying capacity in your red blood cells. You don't have enough red blood cells. And why does that happen? So first of all, these red blood cells, just like these boxcars on the train are made of iron, each of the red blood cells have a protein called hemoglobin in it. And that hemoglobin is made of iron. It's what gives blood its red color. It's what allows blood to carry the oxygen. So, number one, our body may not be making enough red blood cells. And if we're not making enough of this, and remember, they're made of iron, we're not eating enough iron. Iron is in meat, for example. So when we're eating meat, we're basically eating the hemoglobin of other animals. So that's heme iron. But we can also get iron from non-heme sources, such as certain vegetables, certain grains, vitamins. The non-heme iron isn't absorbed as well. So number one, we're not making enough boxcars. Number two, we're losing boxcars. We're taking one boxcar and we're losing it. It's going out when we menstruate, when we lose blood in our stools, when we lose blood in our bladder. So that's another reason. And the third reason, have you heard of sickle cell disease or thalassemia? You have an immune system that's just destroying these boxcars. So then you have less boxcars. And when you have less boxcars that are being delivered to your tissue isn't getting that oxygen. So what happens? You get exhausted, you get tired, you get pale, you get cold. You know, those are some of the symptoms of anemia. So if you kind of remember this concept, like our red blood cells are like the boxcars of a train, you can remember what anemia is, and remember that what we're testing for is the hemoglobin. So you may go, to your doctor and they may say you have a low hemoglobin, and that means you have a low, oxygen carrying capacity. So
what can you do to fix that? Eat more iron-rich foods?
Yeah, so there are different causes. Everything from eating more iron from the sources we discussed to B12 and folate and other nutrients. So it's the same concept. Eat a well-balanced, nutritious meal. So that will help. If you're losing a lot of blood, you're noticing blood in your stools, and the menstruation is heavier than normal, go to your doctor, get your blood tested, and recognize those symptoms: exhaustion, pale, cool. And then those people out there with sickle cell disease and other situations like that, get your blood tested. So the same concept we come to: go to your primary doctor, get your blood tests, make sure you're not anemic, and
really just pay attention to your overall well-being.
Right,
If
exactly.
something isn't quite right, best advice is just go to the doctor.
Exactly.
Remove all doubt.
Exactly.
All right, Dr. Bose, thank you so much for coming on today.
Thank you.
We're going to take a break. We'll be right back.